Okay, Dr. Lubna, on your hand.
Okay. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد أشرف الخلق المرسلين. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, ladies and gentlemen, and welcome to the 6th webinar on COVID-19. And I'm Lubna Al-Ansary. I'm a professor at the Department of Family and Community Medicine at King Saud University in Riyadh, Saudi Arabia. This series of webinars on COVID-19 has started over a few weeks ago, and I personally find them very interesting, very useful and exciting. And it has been like a time that is locked in my diary so that every Wednesday afternoon, I would really follow this the webinar because it's thought-provoking and very, very useful, very informative. This series of webinars is organized by ARPHA, which is the Arab Public Health Association, hosted by the WHO Collaborating Center for Public Health Education and Training at the Imperial College, London, UK. The center supports several WHO regions and their member states in various initiatives, and it is led by Professor Salman Rawaf, who's the director, and others in his wonderful team like Dr. Harumi Yamamoto, and I just heard her name now, Shinda, and others who are wonderful at the Imperial College. This series has so far covered very important and interesting topics such as the exit strategy, the new normal, surveillance, test, trace, and intervene health systems today and post-COVID-19, self-care and self-management during COVID-19 and beyond. And today we are covering a very exciting topic that is relevant to all of us. The title is Our Mental Health During COVID-19 and After. And it's relevant to all people from all walks of life. As you would probably guess, it's relevant to lay people, to healthcare professionals, frontliners, decision makers, philanthropists, patients with chronic mental illness and their caregivers, and caregivers for anybody who's having a dependency causing condition. And it is relevant to all ages, to adults, to the elderly, to children, teenagers, young people starting their own career, parents, and so on. So we're all exposed to COVID-19 one way or the other we're exposed to its medical and economic consequences, and we're all suffering from the stress, the anxiety, and the uncertainty that is related to it. And we've seen different scenarios and stories. I wouldn't go through because I know that you can all recall many stories. And the question is, should we continue suffering or should we become more mature and turn these experiences into strength? Should we do that alone, or are there others there to help us? How can the healthcare system in particular help us, and is it capable of doing that? And who else can help? You will hear more about this in today's webinar, which will address the following key areas: the impact of the pandemic on our mental health, how to protect ourselves from the mental impact of COVID-19, where to go for help when primary care is not yet fully functional. What about patients with existing mental disorders? How can we protect our staff working in mental health? Are we mentally prepared for the second wave of COVID-19? What are the research and the learning gaps or learning needs, I would say, and any developments in the field? To do that, we have two renowned speakers from the largest global health agency, Dr. Fahmi Hana from WHO Health Quarter and Dr. Khalid Saeed from WHO EMRO. Each will deliver a 15-minute presentation. This will be followed by a panel discussion where the two speakers will be joined by other three distinguished panelists: Dr. Khalid Alkubaisy, a consultant psychiatrist from the NHS UK, Professor Tawfik Khoja, who's the Vice President of ARPHA, and Professor Salman Rawaf, President and Director of the President of ARPHA and Director of the WHO Collaborating Center. With these eminent figures and with your contribution, I believe the discussion that will take place after the two presentations will help all of us come up with more clarity and a new insight on how best to care for ourselves and others in the society. So please feel free to post your questions and your comments, because these would make a difference and would matter for all of us. And we hope that this collective thinking will make a difference in the future, inshallah. Without further ado, right away, We will move into the first presentation of today, which will be delivered by Dr. Khalid Saeed. Dr. Khalid Saeed is a consultant psychiatrist for more than 25 years, is currently regional advisor in mental health and substance abuse at the Eastern Mediterranean Regional Office of WHO. He coordinates work on mental health and psychosocial support in regional emergencies, in addition to scaling up mental health and strengthening public health responses to the substance use problems in the region. He also has extensive experience of evaluations and setting up mental health policies, legislation, treatment systems, and services in countries in the Eastern Mediterranean region. Dr. Khalid Saeed will talk about mental health and well-being of healthcare workers within the context of COVID-19. Welcome, Dr. Khalid Saeed, and the floor is yours for 15 minutes.
All right. Thank you very much, Dr. Lubna, and thank you very much, everyone. I think what I would like to start off with is to have a short overview of what we mean when we talk about mental health. Because often what happens is that we tend to equate mental health with mental disorders, which is an important but a relatively small part of the whole scenario of mental health. Mental health for me means that whatever we are today is determined by our mental health. In other words, what we learn, how we perceive things, how we think about it, how we feel, and how we communicate, whether through our behaviors or through our verbal communication skills. Now, that obviously determines how we react to our environment and relate to our environment, how we relate to people around us, and how we go up to contribute to our society and to our community and achieve our own potentials at the same time. Now, that would mean that if how we feel, how we think, how we see things and perceive things determines our mental health, and is one that, so anything which can affect these things is likely to impinge on our mental health positively or negatively. And when we are in difficult situations like the current pandemic, and EMRO is no sort of stranger to difficult situations. We have more than half the countries in long-term emergencies, from Afghanistan to Libya to Syria to Yemen, Somalia, and so on. So that would mean that people are being exposed to difficult circumstances already. And on top of that, we have COVID-19 pandemic. Difficult circumstances. Now, what would that mean? That people would be feeling stressed. And generally speaking, stress should not be taken per se as a negative thing, because stress can be a positive force in helping us achieve and strive. But once it becomes too long, too much, or too sudden, then it can lead to different mental health problems. And that is what we are seeing here, that this current pandemic, which now has almost 10 million cases with 500,000 deaths, in EMR at this point, relatively speaking, I mean, we are about 9% of the global population in this region, and we have about 10% of the total confirmed cases worldwide. But in terms of case fatality rate, we still have something like half of the global median there. And what we are also seeing is that it is not just the pandemic infection itself, it's the measures which are being taken to mitigate it, they are also contributing a lot to this additional stress. And we can just look at one of the figures that close to 90% of the workforce in Arab countries at some point was under mandatory or recommended workplace closure situation. And also, as Dr. Lubna and Dr. Salman were previously mentioning, the economic issue, we can see that there has been more than 10% drop in the global working hours. And it's about the same in Eastern Mediterranean regional countries, with affecting mostly the high income and the lower and lower middle income countries disproportionately. Now, that means that it is not just the workers, whether they are health workers or other frontline workers, they are being affected, but at the same time, the organizations are also being affected. And the effects can take various forms, not only related to mental health, but also physical health problems as well. And sometimes when people are under stress, we do know that they adopt different strategies to handle that stress. Some of them are healthy, and we'll talk about them. But there are lots of times when people start having unhealthy coping mechanisms, like substance use, for example, gaming, excessive screen time, and so on and so forth. So all these are important to understand and to acknowledge that it is not just one or the other aspect. Health is a totality, so impact on one portion, whether it is social, mental, or physical well-being, is likely to affect the holistic health picture. And that's what we are seeing here. So that means that we need to not only think in terms of what the workers can do or the staff can do, but also what the organizations should be doing. And that is actually upstream work is equally important. Rather than putting all the responsibility on the healthcare staff or other frontline staff to take care of their own self, we need to also think about upstream changes which can be made. And this is actually a very opportune time to discuss these issues. So and the reason is that not because organizations are doing any favors to the employees, they are actually doing a favor to themselves, because in the absence of good mental health, it's going to cost them. Their productivity would go down, the rates of accidents and other problems tends to go up, and there is clear evidence for that as well. So that's why it's important that organizations need to take a look at the way they are functioning, the way they are preparing their staff, they're making sure that they are protected properly and they are provided with all the necessary equipment. But at the same time, they are also empowered in terms of some degree of flexibility in the way they work. And the staff, senior staff particularly, need to become role models and lead by examples. But side by side with that is the fact that despite what all the policy changes which can be done, there is going to be a certain proportion of staff which would develop mental health problems and would need services. So that provision needs also to be put into place. It should not be something which should be looked down upon or should be constructed as weakness or things. So that's extremely important. In addition to that, obviously, there are lots of things which the workers, health workers or other frontline workers can do for themselves. First one, that's why I put it up immediately after the what organizations can do, that do communicate with your supervisors. And it's a duty of the supervisors. In lots of cases, it's a legal duty, but it's also a moral duty of the supervisors to listen properly, not only just with their ears, but with their eyes and with their hearts. And I have put down some issues which can be communicated with your supervisor. I'm also aware that in our region particularly, there is a very hierarchical model. So sometimes it might be difficult to talk to the senior level supervisors. So there are mechanisms available in the form of, say, staff associations or other colleagues and peer networks, which might be helpful to make sure that communication moves both ways. Secondly, is to seek support from friends and colleagues. So it might take a simple measure like taking 5 minutes at the end of a day, maybe to talk to somebody you trust, whether it is with your colleague, with a friend, or with a family member, and explore how you are feeling and what avenues of help are available for you. And sometimes it's not necessary that there should be some specific help offered. Just lending a helping ear sometimes is often what is needed. Then the basics. It's important to maintain a healthy routine in terms of having proper sleep, exercise or physical activity. And as we are opening up in most of the countries of this region and elsewhere, increasingly people are able to go out and sort of take part in physical activities, and at the same time make sure that you minimize the use of addictive substances. While we also want to be aware of what is going on, and it is important that we should, but what we are also seeing is this almost obsessive sort of preoccupation with being on the social media 24/7. Now, this is something which is also, we need to make sure that there are certain rules which we put for ourselves as healthcare staff and also communicate it with our family members. And there are definite guidelines available on that. And now, if you look at our website, and I'll show you at the end our resources, that might be helpful. Then basically, it's also important to have a plan. Because sometimes we keep on talking about work only as something which is important for getting money. No, work is also important because it gives us a sense of purpose, gives us a sense of identity, and at the same time, it provides us with a routine. And it's the same for children and adolescents in particular, because school provides them with that sense of routine and sense of safety. And it's the same for healthcare staff as well. So that's why it's important to have a plan of how you're going to spend your days and your weeks. And it might be helpful even to make diaries or different calendars and electronic sort of helps which are available these days. Then we keep on sort of cribbing. It seems to be that social media is also promoting what, among other things, that we are getting to be in the habit of complaining on every small problem which we are having, without realizing that we are also blessed with lots of positives. So it's also important that at the end of a day, it might be a good idea to just recall that there might have been lots of things which are bogging us down, but also to feel gratitude of something which I have done well and I'm grateful for. But obviously, there are lots of things out there in this situation which I have no control on, and no healthcare worker has control on. It's almost at this point, I think Dr. Salman was mentioning earlier on, this uncertainty is there. We have to learn to live with it. No one can 100% predict what the course of the infection would be, when it would end, when would the treatment be available, what nature it would be, and so on and so forth, and how it would affect ultimately the economic, social, political situation in different countries. So we also have to learn that there are things which are in my control and there are things which I cannot control. So try to focus on what can be controlled and what can be done by you. And that sometimes is equally important to learn to live with uncertainty. Then obviously people keep on talking about that we should be doing something to release stress. There are lots of techniques available, and there are lots of mechanisms available which can be useful. And some of them are, I'm going to show you. If you visit our website, is it possible for you to see the website?
Well, it appeared on one of the slides, and then...
No. Are you not able to see it? I can sort of take you there directly.
Okay.
Now, is it possible to see?
Well, you need to share the screen again. So if you're showing a website.
No, I think now I'm good. Is it possible to see now?
Yes, yep, yeah.
So we have recently launched this mental health and psychosocial support platform. So it starts off at the landing page. You would see that there are 3 sections. The first section is about a small questionnaire about well-being to see what the situation is. The section 2 is about stress and how to handle it. And the third section is to provides contact information about different mental health services which are available in countries across the region. And it is for everyone, open to everyone. So I'll just quickly take you through it. If you look at the questionnaire, it starts off by asking where you are from. So you just can click on to whichever country you are in. For example, you might be in Saudi Arabia.
Yeah, if we can wrap it up in about 5 minutes, if you don't mind. Yeah, sure.
And then there are a series of questions, and then you can go down and have a look at different information about stress, how it presents, and what can be done. So for example, one of these progressive muscular relaxation exercises is there, grounding exercises, breathing exercises, and so on. And the thing is that these exercises are available in the form of these illustrations. You can go through, or if you are not interested in reading and looking at you can use the audio version. So there are a number of exercises ranging from fairly simple to slightly more complex exercises. And then, as I mentioned, at the third section is about the contacts which we have at this point received from all the countries that where services can be accessed, either in the form of hotlines or internet-based services and so on, which are being offered by almost all the countries now. So you can see but this is something which we are updating continuously as we keep on getting more information. And then at the end is obviously the contact section. So that's where my name would be. So you can let us know how we can improve the sections. And at this point, we are in the process of having it in Arabic. So I'll stop this and then go back to the presentation. Is it possible to see now?
Yes.
Okay. So I'm just coming to the end of it.
Maybe you can enlarge the slides.
Yeah. So in addition to looking at the exercises which are available, from relaxation techniques to problem solving and so on and so forth, the last thing which I want to highlight is that, as we mentioned earlier on, that organizations need to make sure that professional help is available, but it is equally important that the staff should be sure that it would be confidential, it won't affect their careers, and it won't have any repercussions for them. But at the end of the day, you have to approach the professional if you feel that all these things are not helping and my performance is being affected or my roles as a husband, as a wife is being compromised. So as I said, that there are a huge number of resources, and I'm sure Fahmi would talk about some of them, but there are a number of resources available on our website, both in English, Arabic, and sometimes in French, ranging from global resources to regional resources. So I'll stop here and I'll hand back to Dr. Lubna. Over to you.
Okay, thank you very much, Dr. Saeed, for a wonderful presentation. I've really enjoyed it very much. It was very clear, down to earth, very simplistic, and yet very informative. So I think that this will be useful for organizations as well as workers in organizations. The supervisors, I guess they understand that their healthcare workers are their main asset, but they probably don't know always how to help. And this would help both the workers and the supervisors. And I'm sure there will be many questions related to that. So thank you very much. We'll move now to the next speaker, and that is Dr. Fahmi Hanna from the WHO headquarters. It's my pleasure to introduce Dr. Hanna, who's a psychiatrist by training and has spent more than 15 years of experience in mental health services and its development in low and middle income settings. During his career, he served mainly at duty stations in countries affected by complex emergencies, including the WHO offices in Syria and Libya. In fact, when we were talking just before we start the webinar, he just mentioned that he was locked down in Yemen just a few days ago or a few weeks ago, I would say. So he was really having firsthand experience of how would it be in emergencies that are happening suddenly. And for the past 3 years, since July 2017, Dr. Hanna has been representing the WHO as the co-chair of the Interagency Standing Committee Reference Group for Mental Health and Psychosocial Support, which is shortened for MHPSS in emergencies. So mental health and psychosocial support. And he's the focal point for the WHO for MHPSS and COVID-19. And Dr. Hanna will talk about WHO role in mental health and psychosocial support response for COVID-19 pandemic. And he will discuss what the WHO is doing regarding coordination, developing global goods and supporting countries in this area of work. Welcome, Dr. Hanna, and the floor is yours for 15 minutes.
Dr. Lubna, thank you very much for the introduction, and thanks to you and Dr. Salman for the invitation to present to ARPHA today. Really great pleasure to be with you today. I hope you can see my slides clearly.
Yes, we do.
Thank you. So I arranged my presentation a little bit differently today. I tried to summarize in 3 slides and using only pictures the 3 main functions of WHO applied to COVID-19 and mental health and psychosocial support in emergencies. The 3 main functions are leadership, global goods, normative work, as well as country support. Let's start with the first slide, leadership. You will see down here the picture of a blue book. This is the policy brief released by the United Nations Secretary General last May. And the topic of this policy brief by the Secretary General is mental health and COVID-19. It's for the first time that a Secretary General for a specific emergency released a mental health policy brief. And in his policy brief, he called to have mental health and psychosocial support. We use usually in this area of work this composite term, mental health and psychosocial support, to cover wide range of not only mental health condition, but as Dr. Khalid was mentioning, to cover also psychosocial well-being. Mainly it comes in humanitarian field and in general in crisis and emergency situation. So that's why you find we coining this term MHPSS. It comes mainly from the humanitarian and emergencies field. So the UN Secretary General has called to have MHPSS, mental health and psychosocial support, as a cross-cutting area in COVID-19 response. He called on all United Nations agencies, he called on all governments to have a whole government approach to address mental health and issues related to COVID-19. That was a key milestone of policy work at high level. And not only the UN Secretary General, there was a same call from Dr. Tedros, our Director General at the WHO, who also in May sent to all regional directors a memo calling to have mental health and psychosocial support as a cross-cutting issue within public health and emergencies response. So within the whole humanitarian system, mental health and psychosocial support is cross-cutting of relevance not only to health, to education, to protection, to gender-based violence, to camp coordination and management, to nutrition, to wide range of areas. But within health, mental health and psychosocial support is also cross-cutting, of relevant within the COVID response to clinical management, of relevance also to logistics and operations through duty of care to health worker and other public health emergency responders, as we heard from Dr. Khalid. It's relevant also to partners coordination. It's relevant also to risk communication, where we need to integrate stress coping component. So it's not only a cross-cutting issue across emergency response, but also within public health emergencies. You can see here also the Global Humanitarian Response Plan. This is released by the Office of Coordination of Humanitarian Affairs. And WHO and many partners played a key role here to make sure that in the 64 countries prioritized by the Office of Coordination of Humanitarian Affairs, mental health and psychosocial support is prioritized in COVID-19 response. For the first time in any humanitarian response plan, global one, for the first time, we have a mental health and psychosocial support indicators, counting which countries are establishing cross-cutting mental health and psychosocial support technical working groups. WHO also, back since 2007, is co-chairing the Interagency Standing Committee Reference Group for Mental Health and Psychosocial Support. The IASC, this term, is the highest level humanitarian coordination forum. It exists since 1991, and it is formed by heads of UN agencies. It is formed by heads of NGO coalitions and heads of Red Cross and Red Crescent movement. This highest level of humanitarian coordination forum got a group focusing on mental health and psychosocial support. This group is established since 2007 and known to be very active in emergencies. And one of the traditions of this group is that whenever there is a new emergency, there is a humanitarian system-wide call and they set up the coordination response mechanism. So since January, this group has been, since this was only an outbreak in China, this group, which is co-chaired by WHO, has started to convene calls for all mental health and psychosocial actors globally. 58 organizations are members of this group. That's why this group in February, one of the early responders who had a guideline for the humanitarian system-wide on addressing mental health and psychosocial aspects of COVID-19. This group was also acknowledged in the United Nations Secretary General Policy Brief. One of the roles also of that WHO is playing regarding leadership is documenting good practices. So 3 months ago, we had a call for best practices in innovation in mental health during COVID-19, together with London School of Hygiene and Tropical Medicine, and we launched it on the Mental Health Innovation Network. We got responses from more than 50 countries, and we have more than 100 case studies of countries innovating new ways to continue mental health services during COVID-19, not only documented as blogs or as case studies, but even as video interviews with the champions who are innovating in mental health care during COVID-19. I'm putting here the logo of the Lancet because even before COVID-19, one of the areas where WHO was leading on is estimating the size of the problem. How big is the issue of mental health in emergency situations? And when you see the size of the problem, even without COVID, let's take the example of South Sudan, country of 12 million people, having a big conflict. And the human resource that this country is having is 3 psychiatrists, 3 specialized mental health professionals. If we apply the estimates from Lancet, 1 in 5 people, 1 of every 5 people would have a mental health condition after conflict. In South Sudan, if you apply these statistics, this means South Sudan is having only 1 mental health professional for every 4 million people. A person living in Malakal who have a mental health condition need to travel 2,000 kilometers to reach Juba, the capital, a trip that usually would take more than 24 hours to access the only available mental health services. And this situation is not rare. Even before COVID, this was 1 for every 5 people in a country like South Sudan. Applied to a country like Yemen, there are more than 7 million people with mental health conditions using these projections that WHO developed and published in the Lancet. So I move from the MHPSS leadership slide, where I try to give you an overview in this area, into the area of global goods, normative work that WHO has been active on. And I can categorize this in 3 categories. First, guidance to agencies, to governments, on what are the recommended activities to do to address mental health and psychosocial support related to COVID. So as I said, in February, in first week of February, we released an interim briefing note, which was through an interagency consensus process approved by 58 organizations in a process led by WHO. And then we released an annex for this called the Operational Consideration Document, where we put guidance for how to address mental health and psychosocial support through a cross-sectoral approach in education, in nutrition, in protection, in other areas of work, as well as in health, during the COVID-19 pandemic. What are the adaptations required for every clinical setting related to mental health to integrate mental health and psychosocial support during COVID-19? So the first category is about recommended activities to organization. Second category was guidance to responders. So COVID-19 affect not only the respiratory system. COVID-19 got mental and neurological manifestations. That's why in May update of the clinical management of COVID-19, you will see a chapter on management of mental and neurological manifestation of COVID as part of the core symptoms of COVID-19. Conditions such as delirium, such as insomnia, conditions such as depression and anxiety. You can see how to manage that in the context of COVID-19 patients as part of its clinical guidelines. And then the second document here is basic psychosocial skills for COVID-19 responders. And if you look at the cover of the document, you will find wide range of workers. This is not only healthcare worker. You will see police officer. You will see grocery store worker. You will see health worker. You will see funeral workers, food transportation, and food distribution officers. Basically, everyone in their day-to-day response can integrate a very basic set of skill for psychosocial support to improve the well-being of the people while they're responding to COVID-19. And then the third category of products would be the public advice. Material for everyone. There is here the guide that you saw by Dr. Saeed's presentation, Doing What Matters in Times of Stress. This is an illustrated stress management guide developed by WHO and based on randomized control trial. It was tested before COVID and released within the context of COVID. There are wide range of social media materials that was distributed through WHO social media channels. And there is a very interesting resource here that you would see, this children book, My Hero Is You. We wanted to develop in a creative way messages for children. In March, we had this idea and we sent a survey and we got responses from more than 2,000 children, aged 6 to 11, and their parents and their teachers, their caregivers, responded to us from more than 100 countries, telling us what stressors are facing children during COVID-19. And not only stressors, what parents and caregivers are doing to help children cope with these stressors. And instead of just providing guidance, we had a professional story writer who started drawing a children's storybook for boys and girls aged 6 to 11. And this was released on 8th of April. The document was released on 8th of April, big interest of media it got. And then the document now, when we released it, we translated only in the 6 UN languages. This book is released less than 3 months ago. Now it's available online, translated by governments, translated by UN agencies and international NGOs to 111 different languages, making it one of the most translated books ever in history. To the extent that we developed also a dedicated web page for the country level adaptation of this children book. The huge uptake of this children book just shows that families parents, caregivers are seeing mental health and psychosocial support as a key priority, if equal important to physical health. As I said, we did not translate all the 110 translation. This was done by governments, by UN agencies and international NGO in 2 months' time. And then I moved to country support. One of the mechanisms we activated during the COVID-19 is developing through standby partner mechanism, rapid deployments. And rapid deployment surge mechanism is known in emergencies. And we managed to do that in January, where we had surge deployments to 7 countries, and that was during the preparedness phase. Places such as Ethiopia, such as Burkina Faso, such as South Sudan, such as Libya, and others, where UN agencies requested surge deployment mechanism. In fact, this is a picture of a person from Kenya who got surge deployed to Ethiopia to coordinate the MHPSS technical working group. This is the moment she landed in Addis Ababa. And now we moved to remote deployments. So we do to countries where it's difficult to have the person deployed to coordinate the response. We do remote deployments. This is the second picture is from WHO Philippines. So people are coordinating mental health and psychosocial support through the health sector by having a focal point at every health facility. And this is an image from a teleconference at WHO office in Manila, coordinating the health, the focal points for MHPSS in different facilities across the country. Third picture is for a monitoring and evaluation session for mental health and psychosocial support activities among health workers in Ukraine. Fourth picture is an activity that my colleague Dr. Khalid has mentioned is widely available now in many countries in the EMRO region. This picture also is from Euro region, from Turkey, for cross-border support provided by Turkey in Gaziantep to Idlib operation to provide mental health and psychosocial support through a helpline. The last picture in this first row is from Halab. This is a mobile team providing services at home at a lady with severe mental health condition. So they visit her at home, provide the needed medication, and provide basic psychosocial support. People are also innovating. The picture below here that you see in Greek for the children's storybook was actually done during the lockdown in Athens. People would had take the children book and attach it to a newspaper, so the story can reach children at their homes during the lockdown and support them in coping. The next picture is actually another adaptation from a very different context, the one you see with the native Indian Americans. In fact, this is the very same children's storybook on stress coping, but adapted by Johns Hopkins University to native Indian Americans in the Turtle Islands in United States. So in that context, they did not adapt it as a dragon, which is of no relevance to that context. They adapted it as an eagle, which was more relevant to that context in a systematic process in an intertribal workshop. I'm putting here just as an example for how cultural adaptation can go for mental health and psychosocial support for population which is vulnerable in the United States, such as Native Indian Americans. And the next picture, in fact, is from Gaza. Norwegian Refugee Council make a radio series, مسلسل إذاعي, about this children's storybook for the children in Gaza.
Excuse me, Dr. Rahana, is it possible to point to the picture with your mouse?
Sure. Sure. The one in Arabic with بطلاتي أنتِ مسلسل إذاعي الخاص بغزة. Thank you, Dr. Lubna. I hope you can see my pointer.
Yep.
Perfect. So this was done by the Norwegian Refugee Council for children in Gaza. I'm just putting these examples, but there are hundreds of others for how these tools was used for country support and adaptation to local context. The next one is difficult to see. This is actually Braille. So children with blindness would need also to listen to listen about tools like this. So in fact, this is a Braille adaptation of the same tool for mental health and psychosocial support, was done by a group of blind mothers from the Zimbabwe Blind Mother Trust, adapting the same children's storybook, but for other blind mothers to be able to read it to their children. Similarly, in a website that I'm going to share after, after this presentation, you will see adaptations in sign languages. You'll see adaptation in audio version for children also with blindness. And then I move to last slide, which is a map. It's a map of Sri Lanka from a WHO publication called Building Back Better Sustainable Mental Health Care After Emergencies. And in fact, this map shows in Sri Lanka how in a process that took 7 years, Sri Lanka, after a long civil war, and then was followed by a tsunami, was able to raise mental health services. All the pale colors that you see here in Sri Lanka's map were places without mental health services. And Sri Lanka was able, through WHO support and other partner support, to build a sustainable mental health care system during the emergency. And we see this, and Dr. Saeed can share with us more, in many countries, in EMRO region and all around the world, that mental health and psychosocial support during emergency get attention, and after emergency is an opportunity to invest in mental health scale up. And there are so many cases in the Building Back Better and from WHO experience for countries that used emergencies as an opportunity, not only to build back better, but also we need to use it as an opportunity to build better before the next emergency. Thank you, Dr. Lubna.
Okay, thank you very much, Dr. Hanna, for this wonderful presentation. And it's clear that the MHPSS, the Mental Health and Psychosocial Support Network, and the Mental Health Innovation under the leadership of the WHO and the UN Secretary General has really produced many success stories that are fun to have and to know, and to think how can we adapt these successes into our Arab region. Do we have success stories that we can share? What can we do about it? I guess that we will hear more and more during the discussion. And now it's time to have the panel session. In the panel, we're going to have the two speakers, the two distinguished speakers, as well as Dr. Khalid Alkubaisy. He's a consultant psychiatrist from the NHS UK. And I'm looking forward to hearing your comments about the two presentations that we've just had. And Professor Tawfik Khoja, the ARPHA Vice President. And I would say that Dr. Khoja is a kind of, I would call him as a godfather for public health in the Gulf countries, and he has definitely made a lot of effort, although we agreed that we're not going to use any titles while we're introducing others, but I thought I will just use this one. The final panelist is Professor Salman Rawaf, who's ARPHA President and the Director of the WHO Collaborating Center. And now I would say that he's the real godfather for public health in the MENA region. I can see him in many occasions, and I can see many situations where he has really made an impact, and we are very proud that we have someone like him still supporting the region as much as he can. So with these 5 panelists, I guess that and with your contribution and questions, we're going to have, I'm sure that we're going to have a lovely discussion.
Thank you very much, Professor Lubna. Thank you very much indeed. Excellent presentation and excellent leadership from you. We received a lot of questions, but let me open the space now for my colleagues, Dr. Tarik Alkubaisy. Dr. Tarik, any comments about what has been presented by our eminent colleagues from WHO Cairo and WHO Geneva?
Thank you very much for inviting me, and also it was really an excellent teaching session for me to learn a lot about the WHO, especially from the gurus in WHO and in public health. So it's really an honor to join you. Actually, the event itself is so important to enlighten us as professionals, as well as to enlighten the public. So this is very important. And while I'm going to go through the what has been nicely produced through Dr. Khalid and Dr. Hannah, I think what was coming to my mind, why we shouldn't have something from the WHO as a media, which most of the work of the WHO now is concentrating on the relationship between the governments, the nations, and the WHO, and then it extends to the community. So I think this is something which is missing now, which we need to go through the social media of WHO, through TV for the WHO, through other means, to go to the to people directly rather than to be blocked by some of the authorities. Coming back to the excellent and enlightening presentation by Dr. Khalid Saeed, which I was really interested in, it went through the definition of and the importance of mental health, and it has highlighted many core areas in the expression of what the mental health would mean, and what are the components from the behavior, the communications, and then he highlighted what can affect on them from the stressors. And I liked what Dr. Khalid highlighted, which is always forgotten, is the positive side of stress. Without the stress, we don't function. Without a reasonable amount of stress, without a reasonable amount of salt, everything would be tasteless. So stress is very important to keep us going in all functions. However, when it is acute or when it is too much, then it blocks the abilities to concentrate and to perceive things, and then we will change into an idle organism or communities without that. So that's very important to control and to try to manage. Then other interesting thing that he has very successfully organized the talk and the effect of the stress on individuals, on organizations, and on the workers, and how it's affecting them financially and work-wise, and the productivity. Then the important thing that what are the responsibilities, and this was very nicely highlighted about each sector of these to have their own responsibility, which means that any community cannot function if any one of those components don't function. If I don't bear my responsibility as an individual, there is no community responsibility. So if we don't understand that, then we will be going into catastrophes. Similarly, as organizations, starting from the hierarchy from the government until simple organizations, if they don't understand that the productivity depends on people and those who are producing the outcome. So if they are neglected, there will be no outcome. There will be some initial rise in the productivity, but then after a while, all of that will vanish because there will be no workers. And the important thing also, which has been highlighted, is about the mental health and the physical component. And usually Professor Rawaf has heard us saying that on another occasion, we were only amongst doctors, and the doctors were only concentrating on the physical side. However, we tried to highlight also there is the physical side, the psychological side, as well as the social aspects, which the approach which all of us are working for is the biopsychosocial approach to tackle the problems. And this was very nicely illustrated in the COVID-19 problems which has been seen. And then actually it was very nicely put what can be done on an individual level. And I don't want to repeat that to save time for other colleagues.
Yeah.
On the other side, actually, Dr. Hannah has very nicely enlightened us about the hidden and giant roles of the WHO, which honestly, most of it I wasn't aware of, although at some time I was one of the executive committee of the Iraqi Red Cross at some time ago. So I didn't know about that. I wish I could have been aware of that. So he actually very nicely illustrated all the needs to try to deliver the message to different sectors of the community, which has complemented what Dr. Khalid has mentioned. And I think what I would love to, as I said in the beginning, I would love to have all this excellent work to reach the perceptions of the individuals all over the globe, rather than only to concentrate, because I know from the politics that we have to go through the official sites, but then we know that nowadays the social media are really an important factor to go through there. So why not a TV for WHO in different languages, and also other social media to be governed solely and only by the needs of the WHO and what's required. Finally, may I just remind ourselves, I like WHO definition of mental health, where it directly says there is no health without mental health.
Yeah.
And thank you very much for...
Thank you, sir. Actually, you raised a valid point, but before I go to Professor Khoja, there is an important question based on recent report saying that almost all COVID patients will finish with post-traumatic syndrome symptoms. And I just want to ask my speakers, Dr. Lubna and you, Dr. Tarik, how much we take a bite out of this statement. It appeared in a couple of papers. So I don't know, Dr. Hannah?
Or any people exposed to extreme stressors, wide range of mental health conditions can happen. What we know from larger scale emergencies, I mentioned the example of conflict settings. Not everyone would have a mental health condition, but we would say 1 in 5. And we talk about wide range of conditions. Post-traumatic stress disorder is one of them, but conditions such as depression and anxiety, psychosis, bipolar are among the conditions that we see in population affected by conflict. We hear reports coming from countries. We haven't seen a global wide survey for all people, but the reports coming from countries are alarming. We see, for example, that 50% of the population in Canadian health facilities has said of the health workers there has said that they need mental health and psychosocial support.
I'm specifically talking, Dr. Hannah, about patients. Let me go to Dr. Lubna with her.
Dr. Salman, if I may,
I'll come back to you, Saeed.
No.
Professor Ansary, with your primary care hat,
okay,
how do you see this problem of post-traumatic syndrome among COVID patients? And also, now we know that studies showing that those with serious infection, which may finish in a hospital, etc., even moderate infection, may finish with a chronic conditions such as fibrosis of the lung or damages to the kidney or the liver, which may be permanent. And adding that mental issue, it makes it a very complex outcome of this disease.
Well, COVID-19 is something that we are learning about it and about its consequences on the go. So as we have more and more cases, we are learning about it. But generally speaking, I would say that anyone who's exposed to such a traumatic experience, such as being a patient with COVID-19, is on the at-risk register, is flagged for having post-traumatic stress disorder. I mean, even those who are diagnosed to have COVID-19 and they are asymptomatic are still worried and they are not sure of what to do, although it's likely to have a majority of cases that are asymptomatic if we did mass screening, but they are still worried about the consequences that they have heard of. But then we have those who have really had a severe case of COVID-19 and and they would hopefully recover, or they would hopefully, or they might come up with a disabling complication. We don't know the exact figures, but we need to keep on the alert. Whenever we have a patient with COVID-19 diagnosed to have to be positive, or a contact of a person with COVID-19, they need special care, they need special follow-up, because they are worried. The media is producing a lot of information, and we don't know about the accuracy of these informations. I mean, even this report, I'm not sure which agency has produced this report, and I haven't read it. But I mean, I've been exposed to a lot of information about things that would help prevent COVID-19, or things that are useful. The uncertainty about even the medications that would help or not will help. The talk about dexamethasone as if it is the miracle drug, although it's something that we know. People are confused with so much information. So if they are diagnosed to be positive, I think they need special care to make sure that they are going smoothly out of it. So we have to have a register of those patients, and we ensure that they are okay. I'll just put a comment on one thing that I read it through the discussion that is happening on YouTube, and I like that, because the caring for COVID-19 is not only the primary care physician, it's a primary care team or a mental health care team. And there has been a discussion about nurses and others, and I like that it is brought to the surface, because it's not only us, it's a team that we work together and we exchange our strength.
We always, when we talk about primary care, we talk about primary care team. Khalid, what do you think?
Is that me? Or
question about post-traumatic, Dr. Khalid.
Yeah.
Dr. Tarik, I'll come back to you. Don't worry. Keep the slide on show. Dr. Saeed.
Yeah, thank you very much, Dr. Rawaf. I think the question is important, because we need to, if you look at some of the large scale studies, for example, the earlier studies which came out of China with almost close to 200 cities, they were sampling. And what we were, at that point, they were showing that in the general population, around 35% of the population was showing stress signs.
Yeah.
When the same study design was replicated in Iran, the figures were over 60%, right? And if you look at other countries like India, Denmark, and so on, again, there was a wide range between 35 to around 60% in the general population. But the issue was that in case of people who developed COVID-19, it was not just stress. They developed discrete mental disorders. And as my colleague Fahmi was mentioning, if you look at the rates, about 1/3 of them had the anxiety-related disorders, which include this traumatic PTSD and so on. but other anxiety disorders as well. And they were persistent even after recovery for a while. And that is what we can see from the previous epidemics of SARS, for example, that in that case, people who developed SARS and recovered, they ended up having long-term consequences in the form of depressive illness, for example, or anxiety-related disorders. And this is something which was shown in this one particular study from China, for example, that close to 28% of patients who recovered had depressive symptoms, and around a third had anxiety-related symptoms. And I think what is also important to remember is that what Fahmi mentioned earlier on, that COVID-19 is, I mean, generally speaking, people are talking more about respiratory symptoms. And even if you look at the definition, generally it's about cough, fever, and so on. Yeah, but the fact remains that a proportion of them definitely develop neuropsychiatric symptoms in the form of encephalitis, meningoencephalitis, for example, or go on to develop delirium. And if you look at the fatality rates, people who develop delirium, 28% of them end up dying.
So this is organic in nature, the background for it.
So it is not, so yeah, that's what
the brain may lead to this psychological changes.
Psychological manifestations can be there.
Of the organic changes.
The underlying, yeah, because of the underlying infection.
This is
time, the issue of being healthy, the worrying well sort of, that is also there. So there is a whole spectrum from one end where the worrying well are there to the other end where people who have developed COVID and are presenting with neuropsychiatric symptoms and even after recovery having psychiatric problems.
This is a super point. Thank you very much.
That is
I go to Professor Khoja, but before that, I read a statement which is just mentioned, is about half an hour while we are live on air, from Tedros. And Dr. Tedros, Director General of WHO, just said, the fastest way out of this pandemic is to follow up the science and apply what we know. And he said, we don't know much about the virus, but it is important to apply what we know. And I'm very glad you and all colleagues now mentioned, we will, I think we'll be in better position to explain a lot of things now we are discussing once the science become much more advanced and perfect. Professor Khoja, your questions? Comments? Where is Professor Khoja?
Thank you so much, Professor Salman. Thank you, Professor Lubna Al-Ansary, for really a fantastic leading this seminar. And really, it is a great opportunity for me to see all friends at the same time, excellent speakers. Before I go to the direct three questions, one for Dr. Anna and two for Dr. Khalid, I would like to congratulate WHO for their web page, because this is really, it shows a very rich web page. But in the same time, I recommend during my search study for the mental health due to coronavirus COVID-19, I saw one of the best one. Even I am a family physician, but graduate from UK, but I saw the one which is produced by Maryland. This one, I don't know if it is clear or not. The Maryland Health Department, which is updated June 5th. It really has 5 areas. One of them for health worker, other for adult, for handicap, for adolescent, for infant, and other, also mental health for special peoples or displaced people. So this is, I think I recommend everyone who is listening to us visit this website for Maryland Department of Health, because it's a rich one alongside with WHO. My question to Dr. Hanna, then the other two questions for Dr. Saeed, Khalid Saeed. It seems that we need to have a well-being mental health services for our healthcare workers. Do you think that the online e-mental health hub will be a good advice or a good solution? If it is yes, what are the successful examples in the world in this regard? This is for you, Dr. Hanna. And Dr. Khalid, there are two questions. I conducted a long time ago a study about occupational stress and heart sinking between the primary healthcare doctors. And one of the striking feature is living with uncertainty. And living, as the Professor Lubna and Ansari said, and others, we are living with uncertainty with this disease. And also long working hours. And this will be troubled with epidemics. If it is in normal situation, working hours with a primary healthcare physician or healthcare worker, they have this problem. So in epidemic, it will be troubled or more and more. So what are the solutions? Real life solutions. I mean, what you have said is it's written everywhere. But what are the solutions we can give it to our public health personnel? Keeping in mind there is a fear of infection, worried to be exposed to people. So this is the real situation of stress we are facing with our colleague. We are so seeing it in the website, in the social media, in the WhatsApp, even with my two sons, Dr. Abdullah, Dr. Usama, they are working hand by hand. So really, this is my question to you. So two questions, one for you, one for Dr. Khalid. Thank you so much.
Thank you. Dr. Khalid?
Why don't you start and I'll follow.
Sure, thank you, Khalid, and thank you, Dr. Tarik, for the good question. I think one of the positive aspects that we may gain out of COVID-19 is that there will be advance in mental health. For years, we have been complaining about the lack of access in certain areas. How can we access difficult to reach places in South Sudan, in Yemen, in Syria? And we were saying telemental health for these locations, but people were reluctant to start it. Now in COVID-19, we have to apply what we learned in these difficult to reach areas to be everywhere. There are good examples in the mental health innovation websites that I shared from many countries in the world. And in fact, some of these countries come from the Eastern Mediterranean region, come from also low resource settings in Asia or in Africa. But some of these very good examples also come from Europe and high income countries where outpatient clinics and service delivery platform have been completely adapted to turn online, including prescription system and the medication dispensing systems to patients using online services. The area we think will also advance is the techniques of providing mental health support online. So one of the areas that WHO is working on is guidance for psychotherapy and standardizing this guidance. And one of the projects is called Equip in this area. And this project is developing an online module for building competencies of psychologists on how to adapt their skills for online training. Many of the guidance I shared today include recommendations on that. I'm happy to share the links also to the innovations which describe how telemental health has been used effectively in many countries in this context. Thank you.
Khalid? Thank you.
Yeah, thanks, Fahmi. Thanks, Dr. Salman. Thank you very much, Dr. Tawfik, for asking this particular question. I think there are, as you rightly pointed out, that the primary healthcare, the first line service provider, let's put it like this, that the first line service providers, whether they are doctors, whether they are nurses or other staff, they are under a tremendous amount of stress. And it's infection is one issue, but the other issue also is, as you rightly pointed out, the lack of preparedness. It's very easy to say that let's move online. But the problem remains that particularly when you are, we have never been trained to do the assessments online. We do not find it very comfortable to establish therapeutic relationships when we are not able to see the other person, particularly when it's on the phone or through WhatsApp or whatever. And, we find it extremely difficult to do it. Some people are more gifted, that is true enough, but quite a lot of people find it difficult. So that is the one thing which we need to also ensure, that we prepare our staff to be able to work in this new environment and new technologies. The second thing which remains is the fact that we have been talking about integrating mental health into primary care for ages. I mean, it is something I think since 1979 onwards, from Al-Mata, we have been talking about integrating mental health into primary health care. But in reality, even if you look at the curriculum which is being taught even today in most of the Eastern Mediterranean countries, does not have a significant component of mental health, be it doctors, be it nurses, be it paramedical staff, or other staff. So the problem arises that we are relying essentially on in-service trainings to overcome this gap. But all of us are fully aware that what we learned in medical school is ingrained. It took us 6-7 years to go through that period. And the skills which we learned and the knowledge which we gained is the bedrock on which we build. But if we do not do that for mental health, then we are actually building on very little foundation. So it's an opportunity for us to now talk about bringing mental health into pre-service trainings as well, not just talk about in-service training. And then obviously the issue of continuing professional development. So I think there is a need to think about it in a systematic manner, rather than thinking of ad hoc solutions, that how can we get out of this current pandemic and then go back to business as usual. No, I think this is an opportunity we have now to actually make substantive changes. And Dr. Khoja, being that you have been working with GCC for a long time, and I think it would be a good opportunity for you and Dr. Lubna to advocate that we need to bring parity between mental health and physical health disorders.
Yeah.
Like,
this is
about cardiac problems. We should also be taught about mental health problems in medical school and nursing schools and so on at the same level.
It's a very, very valid point. Thank you very much, Dr. Khalid. And I think if you look at primary care, when you analyze the workload, about 30-35% tend to be psychosomatic. We like to talk about. Yeah. But let us move a bit, because we have a lot of questions actually coming from the audience, and I want that participation. There is a question to all of you. I will start with Dr. Tarik. Very brief answer, please, if possible, because of the time. We have about 12-13 minutes. One question from Dr. Ali Abu Tahin from Karbala, Associate Professor of Primary Care, saying, for those who are addressing the public, we have two groups of the public, i.e. somebody appear on television talking to the people. Half of the people, they are actually have a huge fear about COVID-19 and the spread of the virus, and other people don't care, almost don't care. Actually, there is some denial. And we know in the Middle East, I believe now when they tell me half of the population in the Middle East, they think it's a conspiracy theory. I mean, even the head of the Health and Environment Committee, who is a public health physician, by the way, appeared on television. He said there is no COVID virus, SARS virus. This is simply political things. So there are that sort of controversy. Tarik, how you deal with this when you address the people on television, for example?
Thank you very much. I think these are the outliers, but now they are becoming much more within the dome of the diaphragm.
So converging.
Yeah, it's convergence. Before we had 5% on this side and the other 5% there. But now we can see that with the overwhelming media and the facts which have put people to this 50-50. And this is the space where Uncle Freud, Simon Freud, was saying that here there is ambivalence. And when there is ambivalence, people would go into psychotic way of thinking.
All right.
So they cannot make a decision which way they have to go. So both of them, one would choose one way, the other would choose totally the opposite. And believe me, the one who says that I'm careless about it, I'm denying it, he's much more afraid of that when he actually goes to himself.
So they are pretending.
They are, both of them are, but the problem is they cannot admit it. And this is where we have to be a professional in presenting the information, to use the psychological warfare, which I am just saying that. In the media, it's psychological warfare. We are in a war against COVID-19. And we have to address it on the principles of that. Information, right information, repetition, and easy perception of the resources. And then we have to audit what responses have happened from our messages, and then we have to deliver it. On the other hand, we have to look into what resources in the media we have, and we have to diversify that, and then we have to act on who are the receivers of the message.
Okay.
So if someone,
a
layman,
and
someone who is a PhD holder, but both of them are not very well perceiving the message. So we have to address it accordingly.
Yeah. You're assuming that PhD holder like me will perceive all messages. Professor Khoja, you are a media guru. How do you deal with situation like this? You appear always on television. You are a very well-known face and welcome face too. So how do you deal with situation like this?
I think when I have situation like this, I should present myself based on evidence. I am a public health person, so I should present the case on evidence and bring a real studies, a real data which shows that this is a real infection and it is an infectious disease rather than just my assumption or my perception. This is the problem, that people who are speaking on the TV or speaking in the satellite usually they use my perception, my view, and this is the problem. You cannot convince the people with this approach. You convince them that this is the study, this is the resource, this is the WHO said, this is the Imperial College, whatever, John Hopkins, and so on and so forth. By this, you convince people. When you produce the data in front of the people they will be convinced. The problem with COVID, when it came, there was no evidence. People, even as scientific people, they don't know what is going on, and it was correspondency. Conspiracy. So that is what I gathered in the beginning of the COVID. Not like SARS, not like even flu. It was clear from the beginning. Not like Ebola, it was clear. So that is the issue. I think that WHO play a major role in this area. It should act quickly and respond quickly in epidemics and produce the a statement from the first day to all people and circulate it all over, so people they have one resource of information, a clear evidence-based public health approach. Thank you so very much.
And also timely. Professor Lubna, you beautifully blend between politics and science. And you got very good experience in balancing between the two. It's called diplomacy, or whatever you call it, you know?
Okay.
Yeah. How do we, there's a question in terms of how can we convince government, I think from Nazar, Dr. Nazar, how can we convince government to allocate more resources for mental health? Because especially in our region, as colleagues described, mental health is not given the priority it deserves. I mean, describing South Sudan, one doctor for X thousand and million of population is a disaster. So how can we convince government to allocate more resources with or without COVID? I mean, COVID soon will be out of the picture, but still we need that mental health resources. Yours.
Well, I always think that COVID-19 is a bliss in disguise. We've learned a lot from it, and even policymakers have learned a lot in allocating resources differently from the way that it was done before. And I think that it's not only mental health, although I believe mental health is really important because we're talking about people, the greatest asset of any society. But public health as well has not received enough attention, but I assume that it would receive more attention as a result of COVID-19. How to convince policymakers? I guess policymakers are open. They are under a lot of stresses as well themselves. But when we provide the argument, the correct argument and the correct evidence, they are likely to at least pay attention to it. Maybe they will not make a decision, but at least they will consider it. So it's the way that we present the information to them and its cost, the cost of mental health, not caring enough for the mental health, that will be, I mean, if we're talking about 1 in 5 that are not there available for work, we're talking about 20% of the workforce not being available. If we're talking about post-traumatic stress disorders, provided it's based on high quality evidence, then it is something substantial that they need to pay attention for. So if they are convinced, policymakers would do whatever it takes in order really to support their people. I guess that it's our way of communication that is sometimes too technical or too scientific, too academic, that we're not managing to give the message in the way that they understand it and the way that would make them act on it. So I was thinking that we really need to invest in knowledge management. I mean, leaving policymakers lost between so many sources of information is unfair to them. So we need to invest in those who can really summarize the information and come up with clear themes that they would really know how to act and where to act. And then investing as well in research. I mean, I see nowadays a lot of research going on via WhatsApp, and this is all convenience sample, and this is research that is being sent by authority figures, I would say, authority in the way that they are academics or professors or whatever. I mean, and then we come up with information that we feed for policymakers. How do we expect them to act properly if we're not making the effort of summarizing the knowledge and making in digestible forms for them in order to act? So I would say that policymakers are usually sensitive and to the needs of their societies. We are not yet doing we're providing information, but we're not providing it in a way that would be that they can receive and act on them properly. So we, academia and researchers and the WHO and all sources of information, we need to change our way of talking to policymakers. I like the idea of a TV channel where it's really putting the correct information. I mean, if we're providing, with all respect, an example of Maryland, we can provide other examples from different universities from all around the world. And then we expect them to take the right decision sorry, we are not doing the right job. So
thank you.
We need to work properly for them.
Thank you very much, Dr. Lubna. Translating research is a very good point. And the dying a few seconds, I must finish on time. On behalf of Professor Khoja, the Arab Public Health Association, my beautiful team behind the scene, which you feel their fingers, but you don't see them. I would like to thank you, Professor Lubna, for your leadership. My good friends, Dr. Hana and Dr. Saeed, and Dr. Tarik, thank you very much indeed. You enlighten us tonight. And next week, we're meeting you again with the 3 prominent leaders, 2 presidents of WONCA from WONCA Middle East and WONCA Europe, as well as the leader of primary care from WHO EMRO. 3 prominent people you will meet next week. Thank you very much. Sleep well and be safe. Take care.
Thanks to you. Thank you very much. Bye-bye.
Bye-bye.
Bye.
Bye. Bye-bye.
Assalamu alaikum.